Hi, welcome back, and thanks for joining me on the Healthful Roots podcast. Today, I have Dr. Mina, who's a dermatologist, who is joining us on a really exciting conversation about skin health. Dr.
Yeah.
Mina, would you please introduce yourself to our audience?
Yeah. So thank you so much for having me. And I'm thrilled to be on your podcast. You're putting out amazing information for people. And so I am based in Atlanta, Georgia. I'm a dermatologist and a dermatologic surgeon, which basically means I do a lot of procedural dermatology, which involves taking care of a lot of skin cancers, but also a lot of cyst, lipomas, scar revisions, things like that. And then also some surgical cosmetic procedures, as well as things like injectables and fillers and peels and things like that. But I tend to, my practice tends to be more procedural dermatology. But then that's my day job. But then 2 years ago, I started a podcast called The Skin Reel, because as I was turning 40 and a lot of my friends were, a lot of people were coming up to me asking me questions about stuff. And a lot of it, I thought, oh, well, isn't this, doesn't everyone know this already? And then I realized, actually, no, there's this like huge lack of information out there, and there's just not a lot of good information. There's information, but where are the real skin experts putting out, like the dermatologists putting out skin information for people? Because I know it's hard to see a dermatologist. So my podcast is a way for people to get legitimate skincare guidance without having to leave their house, and just listen weekly for pearls and tidbits.
That's great, and I'm really excited to get into the questions that we have today on skin health. So, one of my first questions is what inspired you to specialize in dermatological surgery and cosmetics, and how has that journey evolved? I know you mentioned the podcast.
Yeah. So I actually was a ballet dancer
Mhm.
before I went to medical school. So I actually did that up until my early 20s. I didn't think I was going to go to college. I was going to just dance. And then sort of the reality hit that I was not going to be a prima ballerina at New York City Ballet or, American Ballet Theater. And I realized I probably should look for something else. And I got injured. And so it sort of forced me to reassess my life and who I was. And I had this whole identity of being a dancer. So when
Mhm.
that was gone, I really was lost as a young adult. But I realized I always loved science, and I wanted to help people. And so I started looking into medical school, and I realized it wasn't too late. I could still try to go. And so almost as soon as I decided to go to medical school, I thought I also want to be a dermatologist. And maybe a couple reasons why. Probably because I had actually seen a dermatologist as a teenager. I struggled with acne. And when my acne was better, I just felt so much better about myself and had so much more confidence. But I also, in addition to dancing, I love to draw and I love the visual arts. And I thought dermatology was a very artistic field. And so I was almost immediately gravitated towards that. And then throughout medical school, I just kept coming back to dermatology, and really, I love that I can look at something and know what it is. And then the surgery side, I really enjoy because it's very problem based. There's a problem and I fix it. And a lot of things in dermatology we can't cure. But with surgery, there are a lot of things we actually can either cure or come pretty close to. So I really enjoy working with my hands. I love the artistic side of it. And so that's been a lot of fun as well, getting to blend sort of my prior life as a dancer with my life as a doctor.
I love that answer, and I wouldn't have seen dermatology as artistic until you explained it that way, because you are like making things better essentially.
Yeah, absolutely. I think there certainly you don't have to, but I think you also have to be very visually acute and aware in dermatology. We don't have, I mean, we have biopsies, right? But we don't need to do a lot of tests all the time to know what something is. So being able to be good at, pattern recognition and
Yeah.
noticing these subtle little differences is really key. And it's not for everyone. Some people think rashes and all this stuff is gross, but thankfully there are people like me who love it.
Yeah, I've seen some bad ones. Okay. Your website mentions that healthy skin begins from the inside out. So do you integrate this in your practice?
Well, if for anyone listening who has seen a doctor or practices medicine, you know that it is really, these visits we have are really, really rushed in the way that medicine is practiced here in the US. 15 minutes, I don't know
Mhm.
how primary care doctors are supposed to get everything in their short visits, and dermatology, man, our visits are super, super fast in general derm. So it's really hard to go over all the stuff I want to go over and all the questions people have. And that's kind of one of the main reasons why I did start this podcast, because it's just impossible the way our system is now to relay all this information to people. But I'm trying to spread the message that really a lot of times people come to their dermatologist, or they'll go to a med spa, wherever they're going, and they want to fix something they don't like about how they look.
Yeah.
And really, a lot, I always say, like, that's like the last 10%. Like, taking care of your body, your emotional, physical, mental well-being, like that has to come first. Like, that's the foundation for not just a healthy body, but also healthy skin. And then the last 10% can be those like cosmetic aesthetic tweaks, if you like. But even beyond cosmetics and aesthetics, we know that taking care of your body, having a as close to normal BMI or weight, can help with a lot of these chronic inflammatory skin conditions, which unfortunately there aren't cures for. But watching what you eat, we know that eating high glycemic foods can flare acne. So really, we can prescribe you medicines, we can perform procedures and do treatments, but really that's almost like putting a Band-Aid on something that we really need to address, sort of the root cause, which it's hard to cover all of that stuff in our short visit. So I really think it's up to people nowadays to just get also good information through reading, podcasts, wherever you like to consume your information.
Yeah, I agree. I mean, we don't have enough time in clinical practice to do that. One of the things you mentioned was chronic inflammatory skin conditions being linked to some lifestyle, like and BMI being elevated. For those who are listening but might not know what we're talking about, did you mean like psoriasis and eczema?
Yeah, psoriasis, hidradenitis suppurativa, some inflammatory bowel conditions. So all of this, and it's beyond just like weight. It's more like diet and the food you're consuming. All of that plays such an important role, whether you smoke or not. Like, all of these
Hmm.
things hugely impact our skin. I think people think of our skin. I always laugh, like they think of our skin as just our face, and whether the attractiveness of it, and they don't really think about our skin as being this living organ that has so many important roles. I mean, yes, aesthetics is one component, but I mean, first of all, we have skin all over our body, not just like above our neck. And it
Yeah.
plays so many important roles. And our skin frequently, this is another cool thing I like about dermatology, is sometimes I have been able to make diagnoses of internal medical conditions based on what I see in the skin. And sometimes this can be life saving for patients, because otherwise they would have waited until they had a stroke to realize that they actually had a problem with the lining of their blood vessels and their collagen and things like that. So our skin is a reflection of how the health of our inner body. And a lot of times people forget that. So how well you take care of your body on the inside, it is reflected in the outside. So I would just encourage people, like, so often where it's like, well, just give me, what cream do I need to put on, or what
Hmm.
procedure do I need to have done? But really, the most important thing is like laying that foundation.
Yeah, and that's interesting. I've had several people on, and everything always goes back to, not just like what your hair looks like or what your skin looks like. We're always going back to the basic principles and how that affects all these other things. And I don't think you can ignore it, right? Like the cream might make it a little bit better, but it's not going to 100% fix the issue.
Right.
Um, so, with that, do you think gut health influences skin health, which seems like you do? And do you have any strategies that you recommend to improving both?
Gosh, well, so we're learning more and more, and I think this area is just beginning, right? I think in the next like 10 years, we're gonna have so much more knowledge in this area that I mean, even from when I was training, we really didn't even talk about the connection. And now we know so much more. So, yeah, I mean, there's this gut, skin, brain connection, and what we eat affects our skin, how our gut health affects our skin. So, and we're also learning about the microbiome of our skin, right? So when
Yeah.
people hear bacteria or microbiome, you might be thinking, oh, that's bad. Like, I don't want bacteria on my skin or bacteria in my gut. But the fact is, actually, there's trillions of bacteria living on our skin right now, and it's actually healthy and good for us. And when we wipe all that away by overly aggressively treating our skin or using harsh products, our skin flares because it's no longer in that balance. And so the same thing is true with your gut. We have so much good bacteria in our gut, and that when we wipe it out by how we eat or taking lots of antibiotics all the time, we are getting rid of not just maybe the bad bacteria, but we're also getting rid of the good bacteria. And then that can cause inflammation, which can cause so many problems, including in our skin. So, yeah, I mean, the gut microbiome and skin connection, I think we're just, touching, skimming, scratching the surface, if you will, on the connection there. But certainly we do know that what you eat impacts your skin. If your gut is not healthy, you're not going to be absorbing nutrients. And when you have nutrient deficiencies, we can see that in the skin. We can see that in the hair. We can see that if your microbiome is out of whack. So again, like another reason why I don't just in dermatology, we used to prescribe antibiotics all the time for acne. And we were the number one prescribers of antibiotics more than infectious disease doctors. And we were prescribing them for non-infectious things like acne. Now, sometimes we need it. We have to do that. But really, the dermatology community has really taken a strong step back from that and really looked at why are we really prescribing this? Because we realize even just like a week of antibiotics can really mess up your gut microbiome and have problems down the road. So again, all these organ systems are connected. And so taking care of your gut is just one component of also having amazing skin. But I'd love to get your thoughts on that, right? Because this is what you do.
Yeah, so I have seen a connection, especially with psoriasis and eczema as well. And when you do stool testing and you see dysbiosis, you can see that they're leaning towards maybe a microbiome that tends to be more inflammatory. And if you treat that right by changing the diet, make sure that they're not eating inflammatory foods, sometimes probiotics can be helpful. You can improve. For most people, you're improving symptoms, but in some cases, I've had some of their symptoms resolved. And as far as skin goes, I had the worst acne when I was in high school. And I got a lot of antibiotics. And even as an adult, occasionally I've struggled with it, only to find out that I had a trigger food. And for me, it's dairy. Like
Mm-hmm.
anytime that I thought like, oh, I'm going to go on a healthy like Greek yogurt kick, I would just start breaking out. And I never put two and two together until like very much like later on. So a lot of times then I work with patients on identifying food triggers. I prefer the elimination diet, right? Like eliminating things and then like seeing what causes a trigger, which could be the same thing for the psoriasis and eczema. But I 100% agree that gut health not only affects the skin, but can also cause inflammation that can cause joint pain and then other issues down the line. But I wanted to ask you because I've seen it maybe within the last 2 years, people coming out with probiotic creams for the face. What do you think about that, if anything?
Yeah, so I prefer, I think probiotics are great when you ingest them. So eating Greek yogurt or fermented foods, kimchi, sauerkraut. I mean, for me, it's easier. I'm not a big sauerkraut eater. I try to have Greek yogurt and I'll take a probiotic supplement. So I think right now there's a lot of interest in that. There are some skin companies that have come out with some products that are supposed to be helpful for maintaining the skin microbiome. So I haven't personally used them, but I've I have had some patients who have tried it and thought it was helpful. So I think, again, this is an area that's just developing and we'll see more of it. But for now, I think really I would focus more than just spending money necessarily on these kind of products just yet. Is just making sure your diet's good and really just keeping your skincare simple. But certainly I think this is something we're going to see more of. I just I don't there are not any products right now that I'm like, oh yeah, for sure, go use this.
Yeah, that makes sense. It is relatively new. And we've been talking a lot about nutrition mostly, but are there any other lifestyle things that you've noticed can affect your skin health?
Oh gosh, so many. And I ignored all this. Like probably you did too when you're in training and you're hustling in your 20s and you're studying and pulling all-nighters and then residency. And then had little kids and all that. And it really wasn't until I turned 40 that I was like, wait a minute, I am taking care of everyone else except for myself. And I was not taking care of myself. So sleep, the importance of sleep. I used to think sleep was a waste of time. I could be so much more productive than sleeping for 8 hours or whatever. But now I really make a point to try to get 7 hours of sleep. It really does make a difference. It is going to catch up with you. You're when you're tired, you're not going to eat well, and your skin doesn't look good. Like you do not. Everyone knows this, right? After you stay up all night, your skin does not look good. So prioritizing sleep, stress management, which is really hard in today's world. Everyone is so busy. We're doing so many different things, but I think just recognizing, like, taking time to slow down and to do something that you enjoy, that's not necessarily work or for your family, is not a waste of time. It's not being selfish, is actually helpful for your whole body, including your skin. What else? Oh, exercise, right? Exercise is huge, and not just cardio. Actually, both cardio is helpful, but resistance training has been shown to be really helpful, especially as you hit midlife and beyond and we start to lose muscle mass. So there have been studies showing that resistance training more than cardio can actually help improve fine lines and wrinkles. And it's thought that it can help stimulate collagen in your dermis. So, but again, also, I mean, that's helpful for your whole body, not just your skin, but just thinking of taking care of I'll say, like, skin health is whole body health, like taking care of your whole body, not doing things in excess, like drinking. I think it used to be, right, like, oh, a glass of red wine a night isn't a problem. And now people are saying really 0 to 2 glasses a week is really the most people should be having. And then of course, not smoking, not vaping. It's hard to have beautiful skin when you have nicotine. And so I don't do either of those.
Yeah, I agree. I agree. And what are some of the common myths or misconceptions about skincare that you'd like to debunk?
Gosh, I think a big myth is that it has to be complicated and expensive. And when I tell people what the products I use and what I do, they're like, what, really? But just, it doesn't have to be elaborate. And I buy my products at the drugstore for the most part. But the thing, what I do is I'm consistent and I do the same thing, and I've been doing it for decades. And, you just need a gentle cleanser, a moisturizer, a sunscreen. And if you want to be a little fancy like me, you can do a vitamin C serum in the morning and a retinoid at night. And that's it. You don't have to buy every product that comes out, like a neck cream, an eye cream, a hand cream, whatever. You don't have to do all these things, but just pick products that are quality with the actives you need and stick with it. And that's the other thing, is people just bounce around. Like, they'll try something for a month. Oh, it didn't work. I'm going to try something else. Oh, it didn't work. And they're mixing too many things, and then they're not seeing the results they want, and they're getting frustrated. So it doesn't have to be complicated, but you have to stick with it, and you will see results. But it's not quick. It's like weight loss. It doesn't happen overnight. Can take months, but if you stick with it, you will see results. So that's a big one. Not following trends all the time, and make sure, who are you getting your information from? Is it someone trying to sell you something? Is it a celebrity who really has no education in skincare and skin health? Or is it a dermatologist who has gone to school for 9+ years to learn about the skin and health? So just be cautious of where you get your information. There are a lot of people trying to sell you skincare products and devices and stuff. So I would just say, just make sure you know what's their angle. Are they really just trying to give you information? And are they really the best, most educated to be giving you that information?
I think those are good. And going off of the first one, just for anybody listening, what do you think is a reasonable amount of time to give a product before you know if it's working or not? Because I know it's happened to me where I use something and I'm like, oh my gosh, I'm still breaking out, or like this is still, I haven't seen it. Like, what's a good amount of time to give a product?
Yeah, well, so for acne, it can be a little shorter. So acne, I would say by 4 to 6 weeks, you should be seeing some improvement. And certainly, if you're getting irritation, you don't need to keep with it. If it's really like causing a rash or burning or
Yeah.
irritation, don't keep going with that. But with acne, really, you should see results within 4 to 6 weeks, some improvement. But with anti-aging stuff, I mean, it takes months. I remember when I first started using a retinoid, and I really think it took me about a year before I looked in the mirror and said, oh, I see it now. Like it took me like when you're staring at yourself every single day, it's hard to see. But then all of a
Yeah.
sudden I just remember it kind of clicked and I was like, oh, okay, now I see what we're talking about. And I see that kind of like glow that happens. But yeah, I mean a year's maybe just because I'm dense and staring at my, looking at myself all the time in the mirror every day. But I would say easily 3 to 4 months before calling it quits.
Okay. And how much of a stickler are you for like ingredients in your skincare product?
So, I mean, I would say make sure that's another thing is people think, oh, hyaluronic acid. Everyone's talking about hyaluronic acid. I need to go get a serum with that, or niacinamide. I need to go get a serum with that. But your products probably already have that stuff in it if you just actually look at the ingredients. So, I'm much more of a stickler for finding quality ingredients in your product rather than expensive or lots of different things. So, I mean, really, the big brands like CeraVe, La Roche-Posay, Neutrogena. I mean, these are great skincare companies. They have very good active ingredients in their products, and in fact, the more expensive ones frequently have ingredients I don't like in their products. They have more stuff in there. They have more botanicals and fragrances and things that can actually cause allergic reactions in people, especially when you use them all the time. So really, I don't love actually like the very expensive stuff, and certainly like lots of fragrances and botanicals. Those I joke, like for botanicals, like stick to like your flowers in your yard or in your house, but not necessarily with your skincare, because it actually can aggravate it and cause rashes.
Okay, that's good to know because I know that there are so many skincare products that you get overwhelmed and you'd think botanicals, it sounds nice that it'd be good.
Yeah, it sounds lovely, right? I mean, I like the idea too. I love mangoes, I love rosemary and lavender and all that, but your skincare products don't need all that stuff in it. And really, just like keeping it simple is really, really key.
Yeah. And so we talked a little bit about the acne side, but specifically when it comes to anti-aging skincare, what are the most important steps to start early in life?
So I would say if the one thing to do early is to sun protect. If you can start this early, you are going to have gorgeous skin in your 40s, in your 60s, in your 80s. I just saw a lady today who was her outside skin was, I mean, bronzed. Her stomach totally white. It was unbelievable the contrast between her arms and legs and her stomach. And I'm just thinking to myself, if she had sun protected, her whole skin would look like her stomach, which looked significantly younger than the rest of her skin. So sun protection is so powerful. It's more than just wearing sunscreen when you go to the beach. It's actually wearing sunscreen every day. It's wearing a hat. It's not going to tanning beds. it's, wearing cover-ups and sitting in the shade. And it makes a difference if, these little things add up year after year after year after year. And not to mention, it will help prevent skin cancers. But really, the people I see whose skin looks the best in their 80s and 90s are the ones who tell me, oh, I never go in the sun, and I don't want to say never go in the sun. Like, I mean, you want to live your life, but
Yeah.
they're not tanning. They're not, maybe they didn't have jobs where they had to work outside all the time. Um, and really, like, I wish people could see what skin that has had sun protection versus hasn't looks like down the road. So I would say sun protection's key. And if you're interested in like anti-aging, then starting on a retinoid. And I really think do the prescription strength if you can, and starting that early. Now, I'm not saying tweens, like tweens don't need to be anti-aging, but when you're probably in your mid 20s, late 20s, that's kind of a good time to start if you're not having children.
Yeah, that's a good point to bring up. And as far as the anti-aging, are there any cosmetic procedures that can help if, let's say, you didn't start with the sunscreen and now you're like 47 or 50 and you're like, okay, what can I do? Is there anything they can do on that end?
Yeah, I mean, definitely. So again, prevention's always way easier and better if you can do that as much as possible. And again, take care of your whole body health first. But then, yeah, if you used to be a sunbather or whatever, and it really just depends on what bothers you. So if you're dealing with a lot of freckling, or what we call like sunspots, lentigines, then things like laser resurfacing or chemical peels can work wonders in removing all that sort of sun damaged skin on top and brightening the skin. Botox is great at preventing lines that get etched in on our face with time. Like we don't even realize it, right? Like you're scowling, then you get those like etched in lines here that people will say, they ask me if I'm angry and I'm not. And it's just because those lines have been etched in. So softening those lines can really help, and it does brighten the skin. If you've got like a lot of broken blood vessels from sun damage, which can also happen, there are lasers that can target that to remove that. What else can be helpful? It just really depends on what bothers you. If you're skin laxity, like you're noticing some jowling here, it really just depends you could do a bunch of things. Like you could do fillers, you could do biostimulants, you could do RF microneedling to help tighten that up. You can cut it out. So there are tons and tons of things you can do. You just have to see someone who's skilled and you trust their judgment, and who can sort of help you tailor, like, well, what really would be the best thing for you given this. Because there's tons of stuff out there. It's overwhelming. You're like, oh my gosh, like, where do I even start? So I would say go see someone who you trust, who's skilled, who's either a dermatologist or a plastic surgeon, like someone who really understands these procedures. And you want the best for doing these cosmetic procedures. They're completely elective, right? So I'm always amazed how people seem to just go to anyone for these things, but they research the heck out of a light bulb on Amazon. So do the
No, I
same due
agree.
diligence if you're gonna go do these elective procedures, because they do have risk with them. Even with the best people, there risk and complications. So you want to make sure they also know how to handle the complications if it happens.
No, that's true. I've had a bad experience with a chemical peel, and I did not do it at the dermatologist's office. So,
Yeah.
yeah, going forward, that is definitely the route to take. So I second that. And the Botox too. I get Botox, and I
Yeah.
joke with my family that I make more friends now that I don't have that line down the middle.
It really does make a big difference. I was just looking at one of my nurses had it done, and it just I was taking some after pictures of her, and her eyes were just open, brighter. She looked like she just got back from a vacation. So it really makes a difference, and you don't need a lot of it. I think people
Uh-huh.
are afraid that Botox is going to make them look weird, artificial, fake. And yes, it can be done poorly. But again, just a little bit used in the right places can give a very nice softening and a refreshed look. And really the goal is no one to know that you had anything done, that they just think
Exactly.
they can't pinpoint what, they just think, oh my gosh, you look like you had a great night's sleep.
Yeah. Okay. And, one of my next questions, which you kind of already answered, was about your skincare routine, and you kind of gave us that answer. But are there any products that you swear by or that you just recommend to your patients?
So I would say anyone who is, you're done having kids, you're not going to be pregnant, and you're probably 35 and older, I would say get on a retinoid if you're not already. Now, retinol is the over the counter version. It's not as strong. If, I'm sort of like, try to go big if you're going to do it. Stick with it, even if you just do it once or twice a week. And sort of get your skin used to it. But I would say a retinol or a retinoid, excuse me, is really like the best bang for your buck long term for keeping your skin looking healthy, beyond sunscreen, right? Beyond like sun protection, because it's like exercise in your diet, right? Like they say, you can't outrun a bad diet, right? Like you got to
Yeah.
still sun protect, but a retinoid is an amazing product. So I just think it's the only night cream you'll need, and especially if anti-aging or boosting your collagen, like these are the things you're after, and a more even, smooth complexion. Like this is the one to be on. I also like a vitamin C serum in the morning, especially if you struggle with hyperpigmentation or melasma. But even if you don't, I don't struggle with those things, but it's still good, to help fight the free radicals from the sun that we all get in our day-to-day lives. So those are two things I really swear by. And of course, sunscreen. But that's really, those are like the main ones that you need.
Well, that's good. And you didn't give us that many, so it's back to what you said at the beginning, that it
Yeah,
doesn't have to be complicated.
right. You just have to be
Yeah.
consistent.
Exactly. Okay, so that makes it, because sometimes you see on Instagram, right? You have these people who are like, "This is my skincare routine, and it takes me an hour," and you're just like, "Oh."
Yeah.
So
It's
yeah, so that
crazy. It really can get crazy. And I would say if you're, don't like, you can get really good skincare products over the counter. You don't have to spend a lot of money. And save your money for maybe doing Botox twice a year if you want, or a chemical peel for a refresh, or not, or save it to go on a trip, like whatever you want to do. But don't, you're going to be better served not spending hundreds of dollars on your skincare and instead investing that in something else.
yeah, that's true. All right, and is there anything that we didn't cover that you think is important for people to know or understand about skincare, or anything that you cover on your podcast that you're like, "Wow, this was really cool, and I want to share it"?
Well, I would say if you don't have a dermatologist, and especially if you are, you know, 40 plus and you've had some sun in your days, it's probably a good idea to get in and just sort of have a look over and make, they can address your concerns. And they also can be on the lookout for skin cancer, which unfortunately the numbers are just like skyrocketing. They're on the rise. A lot of people don't, they've heard of melanoma. They don't realize that there are actually other skin cancers that are more common, like basal cell carcinomas and squamous cell carcinomas. And those are, there's a range on how we treat those, sometimes with a cream or scraping, but other times with surgery. So I just think it's a good idea to get established with the dermatologist. I do find if you have one, then when that rash pops up all of a sudden and you need to get in quickly, it's a lot easier. But I think sometimes people are afraid to go in, or they don't want to, they have a spot and they're nervous, like, well, what if it's nothing and I don't want to waste their time? But you're not wasting our time. I can't tell you how many times someone's come in for a spot and the spot was fine, but then we find something that wasn't. So even if the spot is benign, like, it's still important to get in. If something's new, changing, don't wait. Don't just watch it. I'm always amazed how many people just kind of let something go and forget about it or ignore it. So that's why we're here. So find your local friendly dermatologist and have them take a look.
Yeah, and I'm just going to add to that, age doesn't matter because my
Yeah.
sister had some suspicious findings in her early 20s. So I would just, anybody, age
Yeah,
doesn't
that's
matter.
true. That's true. Yeah, we certainly see it more as you get older, but yeah, even in your 20s, a spot that's funny looking, concerning you, go in and have it looked at.
Yes, great. And I know that you have a podcast and it's called the Skin Real Podcast. Are there any other ways that people listening can connect with you?
Yeah. So, yep, the podcast is a skin reel, and people always are like, "Is that REEL?" But no, it's like real information, REAL. And my handle on social media, Instagram, TikTok, all of them is at Dr. Mina Skin. And then, if people are listening and they want to know exactly what products, I really do recommend that are high quality but not high cost. I have a guide that you can get if you go to theskinreel.com/guide.
Perfect. I did see that. So I'll add all that information in the summary when this comes out. But I just want to thank you so much for your time. I loved talking about skincare and I learned some things as well. And I know it's going to be really helpful for the people listening.
Oh, I hope so. It's been a lot of fun chatting with you, and thanks so much for having me.
Thanks.